Hello everyone, I am Dr. Donald Ozello of Championship Chiropractic in Las Vegas, Nevada. Welcome to Dr. Ozello Sports Medicine Report. Today I'm going to speak about lumbar lateral spinal stenosis. The lumbar spine is the medical name for the low back. Stenosis is the narrowing of a passageway. In lateral lumbar stenosis, there is a narrowing of the space in between the vertebrae on the side of the vertebrae where the spinal nerve travels through after it branches off the spinal cord. So today's class is going to be on lateral lumbar spinal stenosis. Approximately 90% of the population will experience low back pain at some point in their lifetime. Lateral lumbar spinal stenosis is a common source of back and leg pain. Lateral lumbar stenosis is narrowing of the lateral recess or the neural foramen. When the lateral recess or neural foramen are stenosed, symptoms of lumbar radiculopathy may also be present. Incidence of lateral lumbar spinal stenosis increases with age. Symptoms of lumbar lateral spinal stenosis include low back pain that radiates into the lower extremity in a dermatomal pattern. Symptoms may include sharp shooting shock-like pain or stinging pain radiating into the lower extremity, numbness, tingling, or a deep burning sensation, lower extremity weakness, muscle spasm, muscle tightness, and muscle stiffness, muscle guarding, which is also known as muscle splinting, limited active and passive range of motion due to pain and muscle guarding, difficulty moving in all planes, slow and guarded motion in all planes, limited symptom-free range of motion in all planes. Altered gait or limping may be present due to pain, altered sensations, and or weakness. There may be altered reflexes, and the location of radicular symptoms depends on the spinal nerve root involved. The symptoms of lateral lumbar spinal stenosis usually follow a dermatomal pattern because specific nerves are compressed. There may be increased symptoms during rest and at night, but a greater walking tolerance is present when compared to central stenosis. There are three zones where lateral lumbar spinal stenosis can occur. These zones are the lateral recess, foraminal, and extraforaminal. Lateral recess stenosis is due to facet joint arthritis with overgrowth of the superior articular facet and osteophyte formation. This results in compression of the descending spinal nerve root. Foraminal stenosis is due to loss of disc height, foraminal disc herniation, or osteophyte formation with resultant compression of the exiting spinal nerve root. Extraforaminal stenosis is usually due to a far lateral disc herniation with resultant existing spinal nerve root compression. The most common lumbar spinal nerve roots involved are L3, L4, and L5. L5 is the spinal nerve root that exits between vertebrae L5 and the sacrum, and it accounts for 75%. L4 is the spinal nerve root that exits between vertebrae L4 and L5, and it accounts for 15% of cases. And L3 is the spinal nerve root that exits between vertebrae L3 and L4, and it accounts for 5.3% of cases. So again, the most common spinal nerve roots involved are L3, L4, and L5, with L5 being the most common. Disclaimer alert. Please realize that watching this video does not take the place of seeing a medical professional. If you think you have lateral lumbar spinal stenosis, please see a medical professional immediately. Do not hesitate. Viewing this video does not take the place of seeing a medical professional. You can see a doctor of chiropractic like myself, or you can see another type of medical professional. If you start an exercise program, always start at your current health, fitness, and strength levels. Never perform an exercise that elicits or intensifies symptoms. If an exercise elicits or intensifies symptoms, please stop immediately and find a viable substitute. Always work through a symptom-free range of motion when performing all types of exercises. And again, please remember that viewing this video does not take the place of seeing a medical professional. Please see a medical professional. The MRI is the diagnostic modality of choice for spinal stenosis, as it allows for visualization of both soft tissue and neural structures. MRI will confirm the presence of anatomical narrowing of the spinal canal, narrowing of the neural foramen, or the presence of a nerve root impingement. As a doctor of chiropractic, I have treated numerous cases of lateral lumbar spinal stenosis. A doctor of chiropractic uses a technique called the chiropractic adjustment. The chiropractic adjustment helps to restore proper skeletal motion and optimize nerve flow. The spinal degenerative process is not 100% preventable, but it can be slowed with exercise, nutrition, and lifestyle changes. Prevention and rehabilitation strategies of lateral lumbar spinal stenosis combine exercise, ergonomics, and nutrition. Some key factors that you could use to help to prevent and rehabilitate lateral lumbar spinal stenosis include not staying in one position for too long, especially when seated. You want to constantly shift your positions, and you want to move through a symptom-free range of motion. Proper sleep ergonomics include, when you are laying supine, is to have your hips and knees flexed. Have a pillow or wedge underneath your knees or lower legs. If you are sidelined, you want to have your hips and knees flexed and place a small pillow or leg separator between your knees. If you are seated, sit in good posture and always use lumbar support. You may want to look into a zero gravity recliner. A zero gravity recliner places the spine, pelvis, hips, and knees in specific angles. This will help to lower the pressure on the lumbar spine. Motion exercises can be performed in a slow and controlled manner through a symptom-free range of motion. Slow static stretching exercises to the lumbar spine, hip flexors, gluteal muscles, hamstrings, and calves can also be performed. You want to look into the McKenzie protocol if a lumbar disc herniation is present. The McKenzie protocol is a series of exercises where you are moving into lumbar extension, which is bending backwards. General nutritional strategies that you can use to help you with lateral lumbar spinal stenosis and other musculoskeletal conditions include eating anti-inflammatory foods, improving your gut health, consuming lean proteins, eating healthy fats, increasing your intake of omega-3 fatty acids, eating a wide assortment of fruits and vegetables, eating a wide variety of healthy foods, hydration. Hydration is extremely important when we speak of joint health. No matter what season it is during the year, you want to stay hydrated. Supplementation should be from certified organic whole foods. Vitamin D is extremely important. You want to get a safe level of sun exposure and then use vitamin D dietary sources and supplementation. Increase your vitamin K intake with green leafy vegetables, and you want to use nutritional strategies that work for your individual needs. Lateral lumbar spinal stenosis can be a debilitating condition. So please see a medical professional. You could see a doctor of chiropractic like myself, or you could see another type of medical professional. You want to do everything you can to prevent this condition. Always remember that injury prevention is easier, faster, and less expensive than injury rehabilitation. So do yourself a big favor and do the motion exercises I spoke about. Use proper ergonomics and use nutritional strategies that work for your individual needs. Thank you, everybody, for watching today's episode of Dr. Ozello's Sports Medicine Report. I am Dr. Donald Ozello of Championship Chiropractic in Las Vegas, Nevada. I am the author of Running, Maximize Performance and Minimize Injuries. You can visit my website, championshipchiropractic.com, where you get additional information on the book, and the book can also be found on Amazon in Kindle and paperback versions. You can visit my website, championshipchiropractic.com, to not only find information on the book, but to also find my blog. My blog contains articles on sports medicine, chiropractic care, spine health, fitness, exercise, and nutrition. Thank you very much for watching today's video. Please feel free to like this video. If you have questions, feedback, or suggestions, please leave them in the comments section below. Please subscribe, and always remember to train hard, but train smart. Get adequate rest between your training sessions. Utilize nutritional and supplementation strategies that work for you. Prevent all injuries, rehabilitate all injuries, and accomplish your